Oromia Health Bureau. Oromia Health Bureau. Orientation on Malaria Laboratory Diagnosis Service Monitoring. Prepared by Muhammad Abdusamad, November 2024. Monitoring Malaria Laboratory Diagnosis. Outlines. Laboratory diagnosis of malaria, application of malaria heredity, malaria laboratory diagnosis supply, malaria laboratory service and its quality monitoring, coordination and communication among stakeholders. Malaria laboratory diagnosis methods. Two methods are present. One, direct diagnosis. Second is indirect diagnosis. Direct diagnosis, direct demonstration of parasites, whole cell or parasites, nucleic acid or products in the blood, microscopy, molecular. Indirect is demonstration of patient's immune response to the infection, immune diagnosis, RDT. A malaria microscopy diagnosis required materials and equipment. One, lens paper. Second, lens cleaning solution. Third, immersion oil. Fourth, binocular microscopy. 5, stained blood film or GIMSA stain. 6, tally counters or counters, tissue paper. 7, slide box or boxes. Malaria microscopy diagnosis is the gold standard method for detecting, identifying, and quantifying of malaria parasites in blood sample. It requires trained laboratory personnel and equipment. Examination made by preparing both thick and thin film on the same slide. Malaria microscopy smear preparation are two types. A, thick blood film. Thick blood film to detect parasites, to measure parasite density. Very sensitive, detecting as few as 5 parasites per microliter of blood. B, thin blood film for species identification has a sensitivity of 20 parasites per microliter. On the right side, this image shows this diagram of thin smear and a thick smear. Malaria microscopy diagnosis blood film staining. GIMSA stain stock preparation ingredients used. GIMSA powder, absolute methanol, glycerol, measuring cylinder. GIMSA working solution preparation requires GIMSA stain stock solution, buffer tablet, distilled water, measuring cylinder. Quality control and documentation. Perform a quality control check for every new batch or lot of stock solution prepared before using it as a working solution during GIMSA staining, before sending it to laboratories for use weekly basis, and any time of suspicion. Record information in the quality control logbook. Blood film staining procedures. Dilute the GIMSA stain stock solution 1:10. Dilute 1 part of stock solution with 10 part buffered water and then keep away from direct sunlight. Can be used for 24 hours. Fix the thin film only with methanol. Add GIMSA working solution 1:10 on both thin and thick film and wait for 10 minutes and wash and dry. Malaria parasite detection and species identifications. On the left side, this image shows Plasmodium falciparum, and the right side shows Plasmodium vivax. B, malaria rapid diagnostic test or RDT. The malaria RDT is immunochromatographic technique. Detects Plasmodium specific antigens in blood samples using monoclonal antibodies impregnated on a nitrocellulose membrane. Specimen type WB serum per plasma. The image so on the right side is how to test by RDT. Malaria RDT testing procedures. This all is on the right side at 5 micro WB to add 3 drops of assay buffer, 3 set time 25 up to 35 minutes. Malaria rapid diagnostic test supplies and the documents. Required supplies: RDT device, sterile blade, lancet, alcohol swab, sample transfer, pipette, buffer, glove, timer, sharp container, biohazard bag, labeling pencil or pen, permanent marker, waste bin, documents and records, laboratory registration book, laboratory test request, and the result reporting form, PIN card, stock card, SOP, job aid. Application of malaria RDT. RDTs can be used at community or peripheral level where microscopy is not available, where no electric power supply. Malaria microscopy diagnosis common methods. Malaria diagnostic test. Advantages and the disadvantage of malaria diagnosis methods. 1. Microscopy based. Advantages: very accurate and specific, provides both qualitative or plasmodium species and quantitative or parasite density data. Reveals the stage of malaria infection. Disadvantage: requires highly trained personnel. Requires reliable electricity supply. Second, rapid diagnostic test RDT. Advantage: provide results very quickly, inexpensive, very easy to use with little training. Disadvantage: unable to quantify parasite density, cannot differentiate between past and present infections, mutation in the gene encoding the antigen can affect the result. Malaria lab supply monitoring. Malaria lab supply monitoring. PHRRL prepare GIMSA stain stock solution and validate its quality and make ready for distribution. Zonal Health Office, Community Health Office or THO, Town Health Office collect the GIMSA stain stock solution from PHRRLs and distribute to their respective health facilities. Health facility should monitor malaria lab supplies and request the right quantity at right time to avoid service interruption. The malaria task forces should also monitor and ensure the availability of malaria laboratory supplies at all levels for RDT and microscopy. Malaria laboratory quality assurance. Malaria task forces should ensure quality of microscopy used for malaria diagnosis at health facility, quality of GIMSA stain solution at health facilities level or IQC performance, appropriate GIMSA reagent, bottle used for transportation and storage, RDT verification and storage conditions at store, peripheral or health facility level. Malaria lab quality assurance. Malaria external quality assurance participation, availability of feedback and discordant results resolved. Facilitate or provide training for RDT tester if needed. The availability of RDT SOPs or job aids. The task force should also monitor the performance of RDT testers or either by checklist or test comparison. Coordination and communication. Laboratory expert should be a member of malaria task forces (MTF) at all levels: zonal, city, town, Warda health facility. The laboratory expert or MTF should monitor malaria laboratory service provision in all health facilities and take corrective action within malaria task force for any gaps observed. All malaria laboratory service performances and other related information should be approved and reported to the next level by respective malaria task force. There should be a communication and a collaboration between different focals. Lab, vice versa, FEM, malaria focal person, logistics. Thank you.